This segment is sponsored by Donaldson Plastic Surgery.
Breast surgery, breast augmentation, that could be a big decision for women, but you know when you're in the right professional hands. We're here today with Donaldson Plastic Surgery and Aesthetic Solution, Dr. Seifert and Dr. Donaldson. So good to see you two.
Good to see you.
All right, we're gonna get to it, and I want you two to just have an equal exchange with me about breast surgery. And we'll start with, what are some of the reasons, Dr. Donaldson, that women choose breast surgery?
Oftentimes there's a lot of changes through pregnancy, and so patients tend to lose volume, particularly in the upper pole where there used to be a little more roundness and fullness, tends to be a little flatter. Patients look at themselves in the mirror, they just don't recognize themselves, and so there's a real opportunity to gain that shape back and gain a little more confidence with it.
And what are some of your choices or some of the different circumstances that you can maybe get an augmentation? Do you do lifts, reductions, all of that?
We see women through all stages of their life. Young women who are desiring a little bit more volume, women who've had children like Dr. Donaldson mentioned, who want a combination of augmentation or a lift or one or the other separately depending on their desires, and women who are older who just maybe want a lift without the use of implants.
Right. So give us the walkthrough. If someone decides, okay, I'm going to come in and finally take this seriously and talk to Dr. Donaldson, Dr. Seifert, one of you two, what is the process?
We have a pretty extensive process where patients will come in, they'll be greeted by our nurse, we'll take some measurements and get to know a little bit about what they're looking for. And then they'll meet one of us, and in that time we'll again take measurements and get a sense for where they are now and where they'd like to be. There's an opportunity to try on breast implants. We'll use a sizing bra and some samples to see what they may like best, and they'll know that by the end of that there's a spectrum that will emerge, and so they may choose to be a little smaller or kind of right in the middle or a little larger on that spectrum, whatever they like most.
Yeah, our process sort of allows women to have a little bit of say, or a lot of say, into what ultimately they want their volume to be. We have physical parameters that we have to stay within for their bodies, but within that, whatever they'd like, we sort of give them their options, let them try sizes on, see what they like.
That's so interesting. It's kind of like that sympathy pregnancy thing to some degree, so they can actually try that.
Mm-hmm.
Absolutely.
Yeah, see what they like.
You wouldn't know until you try it, probably.
Correct. Yeah,
right?
It's hard to tell looking online at photos,
right.
You know, what that's going to look like on you. Everybody's bodies are so different.
Yeah. So once someone has the surgeries can be performed right here?
We'll use an accredited outpatient center, so we'll have
Okay.
a board-certified anesthesiologist in the room the whole time. We find that that's the safest way to go, but also the most convenient. So they'll have surgery, and then they'll come back here after a few days for follow-up, and we'll make sure that things are healing the right way.
And then how long is the downtime for women who want to go through this procedure?
Typically we tell people about a week where they're going to be pretty sore, maybe requiring pain medicine, at least Tylenol and ibuprofen before they get back to work, but there is a little bit longer stretch of time before they can get back to strenuous activity or exercise. Dr. Donaldson, you agree?
Yeah, absolutely. Yeah, every patient's a little bit different.
So the women who come in, obviously now they have the choice of either of you, whomever they might be more comfortable with. And I know you've done so many of these procedures, so that's not even an issue. But is it also nice to have Dr. Seifert too now on your team?
Oh, absolutely. Dr. Seifert's so well trained, and we provide nearly identical products in terms of what we're able to offer patients at this point.
So if someone's out there right now thinking about this, what would be your practical advice to them?
My practical advice would be reach out to us either through the website or call and come in for a consultation. Information is free, and you can also look online, get information that way, and come in with your questions. A lot of people are very educated when they come in here because they've done a lot of research to begin with. They have really good educated questions, and they can get the answers that they're looking for from us sort of on their journey to figure out, is breast augmentation or breast surgery right for them? What do they want to do, and do they want to select us as their plastic surgeons?
Right. Dr. Donaldson, in the years you've been doing this, how has it changed?
There's just been so much more technology. I think the approaches are less invasive than ever before, and so a very small incision can be used. Several different sites can be used for that incision, and so we can really customize it for the patient. The implants are more technologically sound, they're more durable, and the results are just getting more and more natural, more beautiful.
And that's what it's all about, getting results and getting them from the best, the pros right here. Tell people how to get a hold of you.
You can look at our website, donaldsonplasticsurgery.com, or call us, and we'll make an appointment for you.
All right.
Yeah.
Donaldson Plastic Surgery and Aesthetic Solutions. Don't wait any longer. You'll be glad you made that call.